Bismillahirrahmanirrahim. The transport of thyroxine and triiodothyronine to the tissue is described in this video. Upon secretion into the bloodstream, the 99% of the both T3 and T4 are bound to plasma protein. The main pro all these proteins are produced by the liver, but the main binding protein for these hormone is thyroxine binding globulin. The other proteins are thyroxine binding prealbumin and albumin. So then they are slowly released to the tissue. Both of these hormones are slowly released to the tissue. The half-life of the T4 in the blood is about 6 days, while the half-life of the T3 is very less. It is about 1 day. So these hormones, the binding affinity for the thyroxine is high, whereas the half-life of this is 6 days and time to tissue release is slow. While there is moderate binding affinity for the T3 and its half-life is only 1 day, and it's fastly released to the tissue, and then it goes to the target cell, and both the T3 and T4 are then bind with the intracellular proteins, and T4 binds more strongly than T3 inside the cell. So these bound forms serve as slow release reservoir, allowing hormone action over days to weeks. So T4 is a slowly acting long-term storage form, while T3 is fast acting, more immediate action hormone. So the thyroid hormone, especially the thyroxine, has got a slow onset and long duration of action. If a large amount of thyroxine is injected into a person, there is onset of the effect within 2 to 3 days, and the maximum effect is achieved within 12 days. The half-life of the hormone is about 15 days, so the effect decreases, and after 6 weeks to 2 months, there is only partial persistence of the effect. However, this T3 or triiodothyronine has got only the latency period of 6 to 12 hours, and the start of the effect, it occurs within 2 to 3 days. It achieves its maximum effect within 2 to 3 days. So this is a graph that is showing the approximately prolonged effect on BMR that is caused by administering a single dose of the thyroxine. This is illustrating the long-lasting effect of single large dose of thyroxine T4 on the BMR over time. So here you can see on x-axis there is time in days from 0 to 45, while on y-axis vertically there is BMR relative to normal and starts at 0 and peaks at 10. So thyroxine injects on 0 day. It is injected on 0 day, that is the starting point, and there after injection at day 0 there is no immediate increase in BMR. The metabolic rate starts to increase gradually, reflecting the slow onset of the action of thyroxine. Then peak effect achieved at day 10, or after it reaches to 10 units of BMR approximately. This delay is due to strong binding of T4 to the plasma and intracellular protein, the time needed for gene activation and protein synthesis. Then there is gradual decline, and over the 4 to 6 weeks there is decline that reflects the thyroxine long half-life, about 15 days, and serum release from tissue stores. So the effect of thyroxine is slow onset, prolonged duration, and maximal effect is achieved within 10 days. This slow pharmacodynamic profile makes D4 ideal for long-term regulation, but not rapid changes in the metabolism. Thank you for watching this video. If you have any query, please write in the comment box.